Thanks for joining us. I'm WTOP Capitol Hill correspondent Mitchell Miller, and my guest today is Congresswoman Diana DeGette from Colorado's 1st District. Thank you very much for joining us.
Great being with you.
All right, well, a lot is taking place right now in the healthcare space, and you have a prominent voice on health-related issues, of course, as the ranking Democratic member on the Health Subcommittee on the House Energy and Commerce Committee. Of course, there is major focus right now on a lot of healthcare issues related to the so-called Big Beautiful Bill, but related to healthcare, of course, it's a lot about Medicaid. I wonder if you could outline some of your concerns about what is being proposed in connection with Medicaid as these cuts are proposed by Republicans.
We don't call it the big, beautiful bill. We really call it the big, ugly bill because it has a lot of unintended consequences for regular Americans. The bipartisan, nonpartisan Congressional Budget Office just did a score on this bill as it passed the House a couple of weeks ago. And what they concluded is because of this bill, almost 16 million Americans will lose their health care coverage. That includes people who are on Medicaid right now, and it includes people who got the expanded tax credits as a result of the COVID pandemic credits. And so what that means is in order to be able to finance these tax cuts that are targeted at billionaires and corporations, what the Republican majority is doing is cutting healthcare services for almost 16 million people. And that's just devastating to families. These are people who they're working people, they're working jobs, they're in school, they're taking care of aging parents or young children, and they're just going to lose their health care coverage. The good news is because of all of the efforts we've made with the Affordable Care Act and with the tax credits and so on, we right now have one of the lowest percentages of uninsured people in history in this country. And the good news about that is people are getting treatment for diseases, but also people are getting wellness care, and so they don't get so sick in the long run. The other thing about this bill in the healthcare space is because of the Medicaid cuts, we have been hearing so much from rural hospitals and healthcare providers that they're going to have to go out of business. And we know that in some rural areas, if the hospital goes out of business, that's healthcare for the whole community. And it's also jobs for the whole community. I just met recently with some hospital executives who are very, very concerned that their hospitals are going to go out of business. So it's really devastating and it's a mess. And that's why we fought so hard against it.
Yeah, and I'd like to dive a little bit more into the fact that these rural hospitals may be dealing with various issues, very challenging economic issues. We've heard about that here in the Washington area as well. Some of the Virginia lawmakers have issued similar warnings that you just made. Explain to us why it is that these rural hospitals and rural healthcare facilities are more at risk because of these proposals.
Well, so my congressional district is the city of Denver. So it's a very urban district. And of course, we have wealthy people and poor people and middle income people, but we also have a diversity of healthcare providers in big urban areas. And so they have a mix of people who pay for healthcare. But in rural areas, as I said, in many of these places, there's one hospital. So that's the healthcare provider in that rural area. And in some of these rural areas, up to 60% of the people who live there are on Medicaid. So you can see if you take a significant number of people who are on Medicaid and take them off of health care insurance, then that causes the ability of the hospitals to pay for services to go down. And many of them are afraid they'll go out of business. I'll give you an example in Colorado, which is my state. You would think that the urban area of Denver would have the most Medicaid recipients, but in fact, I'm low down on the list. And in Western Colorado, in the mountains, and in Northern Colorado, where the prairie is and all that, those are the places that have the most Medicare recipients, where there's the biggest risk of hospitals going out of business.
And as you know, it's been pointed out that in many red states, so-called, there are a lot of these type of rural healthcare facilities that could also be at risk. But Republicans, as you know, also have been making the argument that they're saying that people that really truly need Medicaid services will not be losing their health care. They point to these various reforms, one of which, of course, is these work requirements. I wanted to get your thoughts on these work requirements for Medicaid recipients. There has been some polling that shows there's general support among many Americans for this idea, although obviously there are a lot of details to work it out. And it's only really been, as I understand it, been used as an experiment, if you will, in a handful of states up to this point.
First of all, this idea that Medicaid is just intended for poor people, very, very poor, sick, elderly people. That's an idea from 1965 when Medicaid was first started. It's expanded over the years, and then we expanded it with the Affordable Care Act. And now, if you think about it, young people who are working in the gig economy, who just don't make enough money to be able to qualify for the exchanges, or they don't have an employer to buy an insurance policy for them. More and more people are on Medicaid as their primary health provider. And that's why recent polling in swing areas showed 81% of Americans support Medicaid and oppose cuts. Now you hear the Republicans talk about everybody who is on Medicaid should either be working or they should be caring for senior citizens or disabled or caring for children or something. In fact, right now, 93% of people are that way. They are working. And in the two states that got waivers to make these so-called Medicaid work requirements, what happened was that the paperwork requirements and the red tape were so extreme that people who were working or who were exempt couldn't figure out how to meet the paperwork requirements. So they got thrown off of Medicaid, even though they were eligible and they were working. Those states finally had to abandon their efforts because what they found out, they were throwing a whole bunch of people off of Medicaid. Then those people were getting sick and going to the emergency room, which of course it's bad health care, but it's also really expensive for those states. So also the other thing that really upsets me is if you impose these so-called work requirements and you throw eligible people off, that's 7.8 million people in this country you're throwing off of Medicaid. Those aren't people who are just deadbeats sitting around refusing to work. They're people who aren't going to be able to meet the red tape. And you're throwing them off of their health care in order to give tax cuts for the very, very rich. So it's not like you're saying let's clean up the program. You're saying let's throw a whole bunch of people off of the program so we can finance these tax cuts. And I just think that's really bad public policy, and it's really inhumane for those recipients.
Related to public policy, another big issue related to healthcare right now, as you know, is money for research, federally funded research. And there have been already many cuts already imposed, but there are also considerable cuts that could be coming down the line. Clearly, they have a lot of concerns across the country, but especially here in the Washington area. Of course, you have the NIH based here in the Maryland suburbs. What are your concerns about the fact that there's a lot of money that appears to be coming away from research rather than moving forward to it?
I've got to tell you, I am scratching my head over this. Why you would cut money from the preeminent biomedical research facility in the world. We are the leader in the world, and everybody looks to us. We're on the cusp of discovering cures for so many diseases, so many cancers and Alzheimer's, Parkinson's, diabetes. Why would we cut that money? And I think there's a lot of bipartisan concern over these proposals. The things that the administration already did, the cuts that they made under Doge, were illegal. because these agencies were all approved by Congress and these budgets were all approved by Congress. And in fact, most of them have been blocked by the courts, which is good news. But the president's budget, proposes a 40% cut to the National Institutes of Health. And people from both parties and across the spectrum have really sounded the alarm about what this would do to our ability to detect diseases around the world, to find cures, to find vaccines. And I think that the president's proposed budget cuts to the NIH are going to have a really hard road in Congress. We have very strong bipartisan support for biomedical research here.
And one other thing I wanted to ask you about is obviously there's been a lot of attention on tariffs. Usually it's focused on big consumer goods or automobiles, but I know that you have followed the potential impact on importing medical supplies. What are your concerns there?
Well, my main concern around what President Trump is doing with tariffs is it's inconsistent and it doesn't seem to, and it doesn't last. So he throws out these tariffs, then he takes them back, then he freezes them or whatever. First of all, we need to manufacture more of our drugs and devices and our medical supplies here domestically. But while we're working on those supply chain issues, we need to make sure that we're not inadvertently putting huge tariffs on those kinds of supplies coming in from other countries, because we're relying on them right now so that we don't have drug shortages right here in this country. So far, President Trump hasn't put tariffs specifically on drugs and devices, but we don't know what he's going to do. And that's part of the problem. When I talk to manufacturers and suppliers, they are concerned because there's no certainty about what's going to happen.
All right. And just finally, as somebody who's been working with people on the other side of the aisle for many years on a lot of these healthcare issues, healthcare is one of those issues that is bipartisan generally. Do you have any kind of optimism that all the attention on these big issues is going to help to maybe cause some of these things to be sorted out a little bit in the coming months and years for that matter?
Well, one thing I always say is disease does not discriminate against Democrats, Republicans, or even unaffiliated voters. Disease affects every family in America. And in 2018, I teamed up with then Congressman Fred Upton from Michigan, a Republican, and we passed a bill, 21st Century Cures, that updated and streamlined the way we do biomedical research at the NIH and then the way we do approval at the FDA. It can't, and we're still seeing benefits of that bill. So bipartisanship, as particularly around healthcare research, does exist. I have a bill that I developed with another Republican colleague last Congress, Cures 2.1, that both seeks to update that bill, but also help us be able to pay for drugs and devices. And this is a bill that's all ready to go. So I'm hoping that I can work across the aisle now that the big ugly bill has gone through Congress. I'm hoping there will be more of an appetite for bipartisanship as we look at trying to find cures for all Americans. But we can authorize all the research, and we want to authorize all the research. We want to have our scientists finding cures, but you can't do that if you're using a meat axe to cut the budgets of the NIH and the FDA, or as Secretary Kennedy is doing, is to not use science-based data for vaccines and other things. You need to always be looking at science-based data. And so that's another issue that we really need to take a look at. And I'm hearing concerns about this on both sides of the aisle and both sides of the Capitol.
All right. Well, we will leave it there. I'd like to thank today's guest, Congresswoman Diana DeGette from Colorado's 1st District. I'm WTOP Capitol Hill correspondent Mitchell Miller. And for more information on this series, go to WTOP.com and search the Healthcare Agenda.